In this session, we are going to demonstrate some basic diagnosis tests and basic mobilization skills for the lower extremity. So I want you to pay attention to this very well. So resisted test for hip flexors now, the chief iliopsoas. Okay, take your knee, then your leg up. You don't apply resistance at beginning of range of motion. Allow your patient to go into the bit of active hip flexor before you apply your resistance, and you need to stabilize. Okay, let's go. Take it off. Push against my hand. Push against my hand. Push, push, push. You ask the patient if he experiences pain. If the patient complains of pain around the iliopsoas, then you know that pathology has actually affected the iliopsoas, or the iliopsoas is a major cause of that pain. Then for abductors, you need to actually ask your patients, okay, take it out, 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 out, push, push. If you experience pain, then you know there is a problem with the gluteus majors and so which are the adductors of the hip joint. And for the adductors too of the hip, flex, bring it out. Okay, take it in. So with this, if there is pain around the region of the adductors, then you know there is a pathology in the adductors or whatever the problem is that actually affects the group of adductors. The adductors are majorly the adductor brevis, adductor magnus, and adductor brevis. Torrent. If you want to assess the integrity of the extensors of the hip, then what you need to do, stabilize the lower back with the pelvis. For easy resistance, flex the knee to almost 90 degrees. Stabilize. Okay, take your knee, kick your hip up. Okay, up, 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 up. So you are resisting the function of gluteus maximus. If there is pain on your resistance, then you know that the pathology has affected the gluteus maximus, which is the chief extensor of the hip joint. It is very important that you check circumduction of the hip joint. So and check if there is pain when you do circumduction of the hip joint. We will now go to some basic diagnosis scale of the hip joint. There's what we call provocative hip compression test. You flex the knee fully, flex the hip to 90 degrees, then you adduct slightly to maintain a position between the head of the femur and the acetabulum. Especially in cases of osteoarthritis of the hip joint, you can do this test to actually confirm. Okay? So what you need to do is now to apply compression. The hip is well protected by a large number of muscles. So if your two hands cannot give you enough effective compression, you can use your chin to reinforce that compression. Okay? You compress the hip. And as the patient if he experiences pain. If he experiences pain, you may have you having degeneration on the head of the femur, or degeneration in the articular surface of the acetabulum. Or if there is a foreign body, then you can also perform this to actually diagnose presence of a foreign body. There's another test which we call Patrick or Fabere's test. This you have to cross the leg of the patient across the knee, stabilize the contralateral side, and abduct the hip. If the patient experiences pain, then you know there is a problem at the hip joint. Note one thing, it is not a sudden thrust, but a sustained thrust. So if it is painful, then there is a hip pathology. Even you may have a case of a patient that you cannot even do the cross-legging. The patient cannot go further than this, then your Fabere or Patrick test is already positive, even without applying that ABD to open it up. So if you get here and cannot proceed further, that test is positive, it's telling you that there is a problem with the hip joint. The hip joint is always very difficult to have a differential diagnosis because of the proximity of the sacroiliac joints and the lumbar joints with the hip joint. So occasionally there may be confusion on whether if the problem is at the sacroiliac or the problem is at the hip joint or the problem is at the lumbar. So but there are some basic tests you have to do that will remove one from the other. We have the SI compression distraction test. Your SI compression test is this. So look for the pelvis of the contralateral side and you try to close up by compressing the pelvis towards another anteriorly. So if the patient experiences pain, then you know this is the problem with the sacroiliac. With that, you have separated it from that of the hip. You can also do your compression test. You can also do your compression test inside lying. The couch will help you to produce a counter force that will prove the contralateral pelvis upward. So you can do this by equally compressing downward. If patient experiences pain, then you know the problem is at the sacroiliac, not at the hip joint. When you do your compression, what happens to the sacroiliac with your compression? Your sacroiliac joint is opened up, thereby stretching the sacral ligaments, holding the sacrum and the ilium together because of that opening. So with this, if this test or compression test is positive, then you are already suspecting the sacroiliac ligament. For the distraction test, you need to cross the anterior portion of the pelvis here, cross to the other hand, and then you apply your force downward by distracting the pelvis. If patient experiences pain, then you know, if the test is positive, you know the problem is also at the sacroiliac. Another major diagnostic test for the Gaislen, for the sacroiliac is the Gaislen sign. Move your patient to the edge, then fully flex the knee joint, flex the hip joint, then you now extend the knee joint. So this is Gaislen sign. If the patient experiences pain, then you know quite alright that the problem is at the sacroiliac. So let's go over this again. Flex the knee fully, flex the hip, then hyperextend the hip joint. If anything experiences pain, then this is confirming to you that the problem is at the sacroiliac joint.